Hello guys, today we will be talking about antifungal drugs, right? Now, at first you should know the structure of fungus. That is the basic thing you should know. Okay. So this is the cell membrane, right? And outside of it, the cell wall. And in the cell wall, the cell wall is made up of chitin, beta-glucan and proteins, right? Now this beta-glucan is synthesized by one enzyme, that is beta-glucan synthase, which is present in the cell membrane. So this is beta-glucan synthase enzyme, right? And okay, this is the cell membrane, right? This is the cell membrane, and the cell membrane of the fungus is made up of ergosterol. Suppose this is ergosterol. Okay, this is the nucleus, and these are the centrioles which helps in formation of microtubules, right? Now look how we can apply the antifungal drugs over it. Okay, the first one and the most important one, that is amphotericin B. Okay, now this amphotericin B acts by the amphotericin B, basically they come in the cell membrane and they absorb the ergosterol, okay, like a sponge. So when it absorbs the ergosterol, what happens? The deficiency of ergosterol within the cell membrane. So ultimately cell membrane becomes weak and leads to rupture. So this is the new mechanism. Previous mechanism was previously it was it create pore within the cell membrane, so that is why it is fungicides. Now other mechanism, like you can inactivate this microtubule formation by the drug, that is griseofulvine, right? And this DNA you can inactivate by a specific enzyme, that is Okay, so you can inactivate this DNA by a drug that is through cytosine, right? And okay, you can also inactivate this beta glucan synthase by echinocandine. That is a group of drug echinocandine, right? And you have to know here one another thing, that is the formation of ergosterol. So what happens basically, there is squalene, and squalene to squalene epoxide by enzyme squalene epoxidase, right? And then squalene epoxide to lanosterol, ultimately from lanosterol the ergosterol, that is the component of the cell membrane. Now in this process, the rate determining step, that is catalyzed by another enzyme known as 1,4 that is 1,4 alpha sterol dimethylase. Okay, so you can block here also, like you can block this squalene epoxidase by the drug terbinafine. And you can block this main enzyme of ergosterol formation by a group of drug known as azoles, right? So let's come to the individual drug. So the first drug, that is amphotericin B. So what should you know about this drug? So this amphotericin B drug is basically an amphipathic drug, which means it has two components. One component is lipid soluble, another component is water soluble, right? Now talk about its mechanism of action. As I mentioned that it has two, one is new and old. According to new, they absorb the ergosterol from the cell membrane, and the old, that is creation of pore within the cell membrane, right? Now the route of administration. Now route of administration, that is, it is given intravenous along with carrier, that is 5% dextrose, right? So now the uses of the drug. So this amphotericin B is drug of choice for systemic fungal infection. Okay, it is systemic, you have to know this. It is not like topical. Okay, for topical we should use other drugs, but if it is systemic fungal infection, the drug of choice is amphotericin B. It is also given in color jar, right? Color jar, liposomal amphotericin B is given there. Okay, it is also drug of choice for mucormycosis and cryptococcal meningitis. Now in case of cryptococcal meningitis, we give intravenous amphotericin B and intravenous flucytosine. Okay, now after discharge, we leave the patient with oral azoles, right? Now the side effects of amphotericin B. Now side effects of amphotericin B include hypokalemia, right? So hypokalemia, so we prefer potassium chloride, potassium chlor, right, to prevent it. Another, that is hypomagnesemia, anemia, and nephrotoxicity. Look, so to prevent nephrotoxicity, what we do, we preload the patient with 1 to 2 liter of normal saline, right? Or sometimes we use liposomal amphotericin B, okay, to prevent the nephrotoxicity, but that is costlier, right? So this is the all about amphotericin. So the next group of drug that we discuss, that is okay, that is azole group of drug, right? So what is its mechanism of action? As I mentioned, that is the blocking of 1,4 alpha sterol demethylase. So there is blocking of ergosterol synthesis, right? Now look, this azole group of drug, it is basically broadly subdivided into two. There is one is imidazole and other is triazoles. Now the imidazoles include ketoconazole and clotrimazole, and triazole include like fluconazole, voriconazole, posaconazole, and isavuconazole, right? Now what is problem with the imidazole group? Look, in case of imidazole group, they block the particular enzyme and they also block the human sterol synthesis, okay? They also block the human sterol synthesis. So that is why the imidazole group of drug, their toxicity is more compared to the triazole group of drugs, right? So here we can use ketoconazole as it is blocking the human sterol synthesis, so we can use it in case of Cushing's disease, right? Okay, so let's talk about its spectrum. So it include like candida, dermatophytes, cryptococcus, endemic mycosis, right? Now let's talk about the fluconazole. So this fluconazole, it is the drug of choice of candida. Which type of candida? Should be systemic? No, it is not systemic, like it is mucocutaneous, because for the systemic we should use what? Yes, amphotericin B, right? So it is candida, that is candida albicans, right? So what kind of candidiasis it is? It is mucocutaneous, cutaneous, right? It is also drug of choice for coccidial meningitis, right? Now another drug, that is itraconazole. Now this itraconazole, it is drug of choice for endemic mycosis, sporotrichosis, uh, sporotrichosis, and tinea crudes, tinea corporis, right? Now we should, in case of allergic bronchopulmonary aspergillosis, we use this itraconazole because we know there is a drug of choice for allergic bronchopulmonary aspergillosis, that is steroid. But if we use this itraconazole, this helps us to decrease in the dose. I mean, in the decreased dose we can use also the steroid, and that is also effective if we use this itraconazole. Okay. Now the next is ketoconazole. Now, as I said, that ketoconazole, that is not used for normally, but because of its toxicity, we can use it is in case of Cushing disease, because it block the menstrual synthesis, right? Now next is voriconazole. So voriconazole, it is drug of choice for Scedosporium trichosporon, and for the treatment of invasive aspergillosis, right? And if it is not responding to itraconazole, then we can use the posaconazole. Okay. Now the posaconazole. So the posaconazole, that is it is used for the prophylaxis of the invasive aspergillosis. We can use it for prophylaxis, and the treatment of choice, that is the voriconazole. But if it is non-responding, then we can use the posaconazole, right? So the prophylaxis of invasive aspergillosis. And we can also use it in case of graft versus host disease, where the immunity is less, right? Because of the immunomodulator we use there. So there is increased chance of fungal infections. That is why we use this kind of drug, right? We also use in case of chemotherapy, right? Because in chemotherapy for leukemia, there is also decreasing immunity. So that is why it is also used there. So the next one, that is the isavuconazole. So this isavuconazole, that is used for mucormycosis, and it can also be used in case of invasive aspergillosis, right? Now the side effects of the azoles group of drug. Now side effects that include, like if I want to talk about the fluconazole, that particular fluconazole causes alopecia, ketoconazole, that it blocks the androgen receptor, so gynecomastia is seen, right? So in case of itraconazole, it causes chronic heart failure, I mean congestive heart failure, and it can cause edema, right? The voriconazole, this voriconazole, it causes visual abnormality, hallucination, sometimes it causes squamous cell carcinoma. Now the common side effect of all these acyl group of drugs, that is hepatotoxicity, right? Now come to the next part, that is the flucytosine. Okay, so what is its mechanism of action? I said the flucytosine that inactivate the DNA, right? So you should know that this flucytosine is the product of another anti-cancer drug, that is 5-fluorouracil, right? Now use की बात करें तो use says that is it is intravenously used, right? In case of cryptococcal meningitis, I already have mentioned that. And side effects, look, as it is an anti-cancer drug, I mean product of anti-cancer drug, so that is why it causes a huge bone marrow suppression. So whenever we use it, we should not use it for more than 2 weeks, right? So that is about the flucytosine. Now the next drug, that is terfenadine. So I have mentioned that the terfenadine that blocks the squalene epoxidase that ultimately blocks the ergosterol synthesis, right? So it is an oral drug, and you should know that its concentration is maximum in skin, nail, right? So according to this, it is the drug of choice for dermatophytes, right? It is the drug of choice for the dermatophyte, and except two, that is that Trinia crudis and Trinia corporis, because the drug of choice for those, that is the itraconazole, right? Now side effects like the side effect like hepatotoxicity and Steven Johnson syndrome are seen. Okay. Now the next drug, that is the griseofulvin. So what is its mechanism of action? That I have mentioned that it blocks the microtubule formation, right? It is also an oral drug, and it also uses for the dermatophytes, and it is drug of choice for what is that? Yeah, that is the tinea capitis. It is drug of choice for this, right? So we have completed a lot. A little portion is left. About next group of drug, that is echinocandin. So echinocandin, what is its mechanism of action? It blocks the beta glucan synthase enzyme, which is placed in the cell membrane, but the beta glucan is component of the cell wall, right? So beta glucan, okay, so the echinocandin that is uses, if we want to talk about its uses, it is used in case of candida albicans, right, and aspergillosis, but as second line drug, not first standard, because we know what is the drug of choice, that is fluconazole. What is the drug of choice for invasive aspergillosis? That is the place voriconazole. Okay, so it is the second line, that is why. So it is drug of choice for Candida krusei, Candida glabrata, Candida parapsilosis. Okay, so for this they have the drug of choice. It is also used for the prophylaxis of fungal infection, right, in case of bone marrow transplantation. Okay, so what are the drugs that are under the echinocandin? The drugs like capsofungin. These are the drugs. I should use another color. Okay, where is that? Yeah. So the capsofungin, micafungin, and idulafungin. So these are the drugs under the echinocandin, right? Now the capsofungin is used for Candida aspergillosis, right? Micafungin and idulafungin, they are used for Candida only. So okay, so side effects. So the side effects include the capsofungin that causes phlebitis, and you should know another thing, that the capsofungin should not be